This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.
The Ahmadu Bello University Teaching Hospital chapter of the National Association of Resident Doctors NARD is on a 5-day warning strike in protest of delayed salaries owed to some of its members. The doctors had given the hospital management a 1-week ultimatum to address their demands, which have so far not been responded to. Executives of the chapter have spoken against percentage payments of salaries and are demanding an arrears as far back as 2021. For more on this, I'm joined by Dr. Abdullahi Dele, who's National President of the National Association of Resident Doctors. Good morning and welcome to the conversation, Dr. Dele.
Good morning, ma'am.
It's a pleasure to have you on. If you could give us a summary look at the engagements between the ABU Teaching Hospital chapter and the hospital management or the federal government, whatever the case may be, just if you could paint that picture for us.
Okay, thank you very, very much, ma'am. Good morning. Thank you for having me. The major problem right now between the management of ABU Teaching Hospital actually edges on the insensitivity of the management of the ABU Teaching Hospital to the plight of the doctors for which they have employed. It's quite painful that a little loophole that was created just to help protect the system is being exploited by the management to create a form of oppression on the doctors that were employed. Now, the issues that is actually affecting the president is bordered on the remuneration. Now, for ABU Teaching Hospital, you have doctors that were employed by the teaching hospital, not the federal government, to try and close up the loophole gap, and you're paying them as a percentage of the salary for which they are entitled. You have nothing to improve their pay is not as far as even their members, their mates at the federal level. And even at the point where it's not you're still paying them a percentage of this fee. Also, some allowances that has been promised to these individuals and also other individuals within the system, which has not been paid. The institution has had for a very long time a poor working environment, which is even affecting the community at large. Now, this working environment has been a source of worry for the doctors that are within, because for them, they are in contact with the patients. And when the patients don't get what they want, they are the ones that get the brunt of all of this, with issues of assault and also verbal physical assault to the healthcare workers within the hospital. All of these are committed in a case where the association has reached out to the management to help improve what they have and create a working environment that is safe for them. But despite different interventions, as it stands right now, the management is not yielding or budging. There's the declaration of this warning agitation, hoping that at the exploration of this one agitation, they will actually see reasons to dialogue and alleviate most of all these problems, so that going forward, the association can actually have what it is the demand for.
So, Dr. Dele, if I may, let me ask you this. How common is it to see hospital management not paying doctors? Because you've been quite specific that this is not necessarily a federal government matter. This comes to the most basic source, which is the management of the hospital. How common is that?
Well, that's very, very common. It's affecting almost all of our hospitals, the major cause of agitation amongst for members of the association across the country. One of the few reasons why the doctors fought hard for us to actually be on the pay platforms of the federal government is because of the insensitivity of the management of different hospitals. You claim you don't have enough doctors. You claim there's brain drain. But when you employ these few in a short gap for loopholes to actually get in before they get to the federal government platform, and then you maltreat them and you pay them, you should change them as much as possible. This is the kind of experience these doctors are going through. Here's the reason why they are leaving the system to look for greener pastures.
And who should we expect to mediate in this matter? Because in many ways it crosses through one, ABU being a teaching hospital would fall under the federal government, but it is also still within Kaduna State, so there are expectations of the Kaduna State government as well. Who should we expect to mediate in this matter?
Currently, post this declaration, the national body which I represent has started mediation, and the Ministry of Health also started mediation. Not actually the purview of the Kaduna State government, it was the federal parastatal. We are currently in discussion with the federal Ministry of Health to discuss with management and see as far as how can we see that the good people of Zaria and the good people of Kaduna State can actually enjoy healthcare services at low cost, at low entry cost.
Dr. Abdullahi Dele is National President of the National Association of Resident Doctors. Dr. Dele, so earlier we were just talking about the move by resident doctors wanting to be migrated to a payment platform under the control and management of the federal government. Are you speaking specifically of the IPPIS?
Yes, ma'am.
At the moment, I understand that you're under a payment platform called GIFMIS, which is the Government Integrated Financial Management Information System. If you could just briefly give us an idea of why you think IPPIS is better than this platform so that we understand better.
Well, thank you very much. Let me quickly put some few things into perspective. As it stands right now, healthcare workers generally, not just doctors, within institutions are both on somehow the IPPIS and somehow the GIFMIS. Now, the IPPIS is the centrally controlled platform by the federal government, which means straight from the federal government to the workers. While the GIFMIS platform, though it's still a centrally controlled platform, trickles through the management of the different MDAs to the workers. Now, the reason why most workers want to move to the IPPIS platform and not be stuck on the GIFMIS platform is because of the manipulations that can be done on the GIFMIS platform by the different heads of MDAs, which tends to actually affect the remuneration. At the centrally controlled IPPIS platform, you are sure that whatever it is your colleagues are getting is what you're getting. But different manipulations are done at the GIFMIS platform, which is resulting to this short-changing of the healthcare workers, especially our doctors, and also the deductions of allowances that they are due right that are not being put in place. So hence the reason why we are hoping that all our members will be moved from the GIFMIS platform, post-capturing to the IPPIS platform, so that at least we are sure pay parity amongst all doctors.
Dr. Dele, thank you so much for joining us and speaking with us on this matter. Dr. Abdullahi Dele is National President of the National Association of Resident Doctors, joining me to discuss the decision by the ABU Teaching Hospital chapter of his association. They're on a 5-day warning strike protesting the delay of salaries that are owed to some of its members, including the payment of arrears as far back as 2021.
This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.